Hi, Dr. Francomano. Thank you so
Hi.
much for an excellent presentation and giving us like a bird's eye view of all the different subtypes of EDS. Was really informative. And I'm just scrolling the questions that we have today. Uh, I think you answered a few of them already in your talk about the genetic tests availability. And as you rightly said, there's now commercial test kits available as well through multiple labs where patients can get tested if they have any variant of EDS. And one question here is, um, does joint hypermobility without EDS have an influence in presenting as CSF leak or not be able to heal from lumbar punctures?
So that's a very interesting question. We know that people who have the hypermobility spectrum disorders present with the same spectrum of comorbid conditions like POTS and mast cell activation and things like that, that people with the hypermobile type of Ehlers-Danlos syndrome do. So I would say that joint hypermobility in and of itself, if it's asymptomatic, probably is not going to put a person at increased risk. But if they have that full hypermobility spectrum disorder presentation where they're symptomatic and having some of those other comorbid conditions, it's likely that they're going to be at increased risk for the CSF leak as well.
Thank you. And I think there's someone asked a question I think which has already been answered. But if you want to talk a little bit about the HEDGE study, which is going on right now, and in fact, there was a before COVID hit, there was a plan to do, as I understand, there was a plan to conduct some part of the HEDGE study in Toronto as well. But because of COVID, that has been rescheduled to a further date. Yeah, if you want to chat a little bit about the HEDGE study.
So the HEDGE study is designed to try to get at those underlying genes, and we believe that there are going to be more than one gene, because if it were a single gene and it were easy to find, we'd know it by now. There have been a lot of people who've been looking for many years. And the goal for the HEDGE study is to enroll 1,000 people who have the meet those diagnostic criteria that I mentioned for the hypermobile type of Ehlers-Danlos syndrome. And we started out by doing screening clinics around the world. We did a couple in Europe, and there were several in the United States. And as you say, we were planning to do one in Toronto. But now, because of COVID, we are moving to entirely sort of online enrollment. Oh. So if people are interested in participating, they can go to the registry at the Ehlers-Danlos Society website, and if they can upload either a checklist that one of their physicians has filled out, or a note that documents that they meet all of those criteria, then and indicate an interest in participating in HEDGE through the registry, we're going to be sending. There's a company that will actually go out to the home and do a blood draw, and then so people will be able to send their blood in through that means, and they'll be able to participate in that way.
Oh, that is fantastic. Thank you so much for that information. Just one last question in the interest of time, I don't want to take any further ado, is 50% of individuals we know with vascular EDS have a de novo mutation. So the question is the positive family history a mandatory criteria to have vascular EDS?
No, it's absolutely not a mandatory criterion. And really, if there is a suspicion of vascular Ehlers-Danlos syndrome, that's one of the ones where I really feel strongly that it's very important to get the molecular testing done, because of the important clinical implications of making that diagnosis, and the fact that so many people are the result of new mutations in the family, so there may not be a family history.
Perfect. Yeah, that's about right. That's how we usually practice here in Toronto. If we have any patient who has suspicion of VEDS, we expedite their referrals and we kind of bring them early because it could be catastrophic if any kind of there's delay that could lead to certain grievous, serious complications. Okay, thank you so much again, Dr. Francomano, and I think we will have another Q&A session, which will be live interactive with all the participants after this last presentation for the morning. Please stay with us.
Will do. Thank you so much.